November is Diabetes Awareness Month. Over 38 million Americans have diabetes. 2 million have specifically type 1 diabetes.
You've probably heard of JDRF. Well, they have a new name now, Breakthrough T1D. Elizabeth Anderson from Breakthrough T1D and Dr. Tony Moran from the University of Minnesota are here to tell us about some of the symptoms, what people can look out for, and how to detect type 1 diabetes even before those symptoms appear. Thank you both for being with us this morning.
It's happy to be here.
Why don't we just start with an easy question for the two of you. What is type 1 diabetes?
So from a very high level, essentially what type 1 is an autoimmune disease. So it's a lifelong condition that people are living with where your immune system is attacking the cells in your pancreas that produce insulin. So these are people that require insulin for the rest of their lives. It's also not related to diet. That's a misnomer. And it doesn't just happen in kids. 50% of people that are diagnosed with type 1 are actually adults. So it's not just pediatric diabetes, it's everybody.
And I'm glad you pointed it out. It's not a diet thing,
Right.
and it does just happen. You don't develop it, you have type 1 diabetes. And why that is and what triggers it, we could probably talk about for 4 hours.
That's true.
What would be the symptoms that someone could look out for if they suspect one of their loved ones has type 1?
So first I want to correct you just a little bit.
Yeah.
It actually has a phase where it's developing where you would have no symptoms.
Sure.
And we would only know by measuring something called antibodies in the blood.
Right.
But once it gets to the point where it's clinically evident, increased thirst, increased urination, weight loss, maybe kids wetting the bed at night for the first time in years, yeast infections, all because of the excess sugar that's in the blood that can't get into the cells without insulin. And eventually, if it's not treated, they can become very, very sick with something called ketoacidosis, which is life-threatening.
You mentioned a moment ago that you can get testing done, that you can test.
Yeah, so these autoantibodies are a marker that the immune system is attacking the pancreas. And they can show up years before diabetes, before anyone has any symptoms at all. So we can test people for this marker, these autoantibodies, and either say, no, you're in the clear, or looks like you're on that path towards diabetes.
And that's the TrialNet.
Yes,
Testing
the TrialNet
process,
is
right.
a national study funded by the NIH, and we are testing relatives of people with type 1 diabetes. So if you have a son, a daughter, a parent, a child with type 1 diabetes, you have approximately a 5% risk. And by measuring these antibodies, we can see you're on the path towards that before it actually happens.
So let's say that a family member has type 1 and you have a sibling of that child who has type 1 and you say, I want to get them tested. If they have the marker for it, like, is there anything you can do early on? Is there any benefit to knowing this? Or is this just kind of like, well,
Yeah.
you're eventually going to get it?
Yeah, that's a great question because a lot of people say, oh, I don't want to know. But there is good reason to know. For one thing, if you know you're on that path towards diabetes, you'll be watching for it. You'll catch it early before you get sick, before you have any life-threatening events. And if you catch it early, it's easier to treat and there's less risk of complications. But the other thing is, there are potentially things you can do to hold off the time before you need insulin. So there's one drug newly approved by the FDA based on TrialNet studies that in half of people who were on the path, it delays the need to start insulin by at least 6 years.
Wow.
And then there are other studies trying to find drugs for that other half of people where it doesn't work or that might work better. So if people are interested, they're potentially eligible for a drug or to be in a study.
Elizabeth, I want to talk a little bit about the name change and Breakthrough T1D. We have a son who's had type 1 diabetes for 10 years now.
Yep.
It was always JDRF.
I know.
We had a big discussion and debate over this in our house about the name change. It does make sense to me because I think the idea is you want to break through to finding a cure someday. And I think we get lost on that there still can be hope for there to be a cure someday. Tell us
Yeah.
about some of the research.
So the research is really exciting, and you're exactly right. We're trying to make that umbrella a lot bigger because most people living with type 1 are adults. They're not kids. So having juvenile gone is helpful. Some of the research we're doing is around beta cell encapsulation. We're doing a lot of work funding people like Dr. Moran to see how we can push that diabetes off for a few more years. And then the other work that we're doing is funding scientists so that we can make life better for the people living with type 1. Once you've got it, it's hard. There's a mental load, there's that physical load. So what can we do to take a little bit more brain space out of type 1? So that's some of the devices that you'll see on people. Their continuous glucose monitors, their insulin pumps, long-acting insulin. It's a big game, but it's all about making lives better.
And Elizabeth, today is Give to the Max Day.
It is.
So how can people give to T1D?
Yeah. Well, we will fundraise every single day of the year because it's always happening. But they can visit our website, breakthrough-t1d.org. I will also say we have our really big walk coming up in May 17th at the Vikings training facility. So that's the other way that people can get involved is by registering for that.
New location used to be at Mall of America for
It's
a number of
great.
years.
Now you
but
can
it's
move
nice,
when we
right?
walk.
You get
It's
to get
wonderful.
outside in the spring.
Yes,
And
yes,
so,
yes.
Well, both of you, thank you so much for your time. Good to see you.
Yeah, thank you for
Thanks
having
for
us.
stopping by and the work that you're doing. We will post more details for you about TrialNet and Breakthrough T1D on our website, minnesotalive.com.